traffic and travel news on the way as well in the next 20 minutes. But next this morning, weight loss, constant pain and no cure. That is, until now, not a cure as such, but Crohn's disease certainly affects around 60,000 people in the UK, and usually sufferers just have to get on with it. However, Jenny Kiff from Wigston underwent surgery recently that has transformed her life since being diagnosed with Crohn's disease nearly 2 years ago. I'm pleased to say Jenny's with me in the studio. Morning, Jenny.
Morning.
Tell us a bit about Crohn's disease, first of all. People have heard about it. They may not know what it is. What is it? What are the symptoms?
It's a debilitating illness. It's your immune system actually starts to attack your intestines, or in fact in Crohn's disease it actually can attack anything within your digestive system. The symptoms that I had were weight loss, loss of appetite totally, pain in my right hand side, which was there. It was gnawing away at me permanently, which in itself made me feel really low, constant diarrhea, and it just altered my life totally.
This was every day of your life?
Yes, it started, the symptoms started to appear April 2009, and I actually put it down to stress at the time. Unfortunately, my best friend had just died, and I put it down to all the stress and trauma of that incident. And it wasn't until 2 months later, when actually I'd lost about 1.5 stone in weight, that I realised I actually ought to go and see a doctor, which I did. And that was when I was referred to a gastroenterologist.
Just to put it in perspective for those people who don't understand, were there good days and bad days? Did it flare up? Was it worse on some days? How did it affect you?
Yes, I did have good days and bad days, and to begin with, the good days outweighed the bad. But then it got to towards the end of May, it got to the stage where actually I got no appetite whatsoever, and I just couldn't face eating anything whatsoever. And it was at that point that I realised that I did need to be seen, and that it probably wasn't just stress related.
Now, because of this, we were talking off air a moment ago about how it affects your life. Apart from the symptoms and the fact that it causes you pain and discomfort, you couldn't get up any day and plan anything without this in mind. It had a massive effect on everything you did, didn't it?
Yes, it did. I'd wake up in the morning, and first of all you think, well, is today going to be a bad day or a good day? I actually work full time, so I knew I'd got to get up, I knew I'd got to go into work, but you were worried about how you were actually going to get through the whole day. And I know that it did affect my work as well, because I'd get into work and I'd begin to feel low, and I probably began to get a little bit grumpy at work and not be able to concentrate so much on work either. So I have to say that my employers throughout the whole of this have been absolutely fantastic, and when it was diagnosed that I did have Crohn's, they let me adapt my working life to, on my bad days, actually being able to stay at home and work from home, and be able to go in on my good days.
What about your family as well? Debbie's sitting next door.
Yes.
I can't believe Debbie, she was ever grumpy. Was she? No. Yeah, your family have been tremendous as well.
They have, especially my husband Richard. He supported me all the way through this. There's been he took over the cooking, everything to do with the household. He's helped me through this. I've got a son as well, and he actually got married last year, so I've had all the organisation of that to get involved in as well, but all of the family have been fantastic and supported me when I've needed support. They've been there for me.
Now, there is no cure for Crohn's,
No.
and there are other branches of this. I mentioned that I know somebody, well, a couple of people, but one in particular who suffers from colitis, which is very similar, but there is no cure for Crohn's at all. So I mean, it's almost like a black hole you were in, with no light at the end of the tunnel. There were no options, really, were there, until you went to see the consultant?
When I first was diagnosed, I saw a consultant called Professor Maybury, who's actually he's an expert on Crohn's and colitis, and I'd never heard of it before I was actually diagnosed with it, so I went onto the internet and did a lot of research, and it was at this point that I found out that there was no cure whatsoever, and what the consultants try to do is actually get the Crohn's disease in remission and keep the periods of remission longer and longer, so that the flare-ups of Crohn's get less. One of the things that they can do is actually you have medication, but it's trying to find the right medication to actually suit yourself, because not everything suits everybody. The first thing they actually do is put you on steroids to try and bring all the inflammation under control, but obviously steroids you can only take for a short period of time, and they have their own side effects. The putting on weight, which I didn't mind personally, bloating face, making you have appetite, but then it's I think it's the bone loss. There's all sorts of side effects that they don't like you to be on, and I tried other medication. I tried infusion, drip into my arm once a month, and also injections into my stomach every 2 weeks, but nothing actually brought it under control. So I'd sort of come to a dead end with the medication route.
So when did the option of surgery come?
I did think about surgery in the early stages of Crohn's, but because of my history, in that I had a DVT, a deep vein thrombosis, which resulted in a stroke 10 years ago, I knew that if I had conventional surgery, then I was at more of a risk of developing another blood clot that could have a more dangerous potential. So that was the reason I went down the medication route to start off with. Obviously, once the medication route wasn't going to work, I knew if I needed some relief from the Crohn's, I'd got to seriously look at surgery. And that's when I started researching surgery on the internet and came across a doctor in Leicester, surgeon in Leicester, Mr Chaudhri, who was actually doing pioneering surgery through just one single incision into your tummy button.
Shall we talk to him?
That'd be great.
Pop your headphones on. You might recognise the voice. Good morning, Sanjay.
Hi, morning, Martin.
Sanjay,
morning, Jenny.
Sanjay Chaudhri is a consultant colorectal surgeon, I think is the correct description, at Leicester General Hospital. And we don't know, I mean, Crohn's is a relatively new find, isn't it? 1930s, I think, it was first diagnosed. We've learnt an awful lot in that period of time, but there's still a way to go, Sanjay, isn't there?
Yes, I think there is a way to go, because at the moment we still quite don't understand what exactly causes it. And we know it's basically a chronic inflammatory disease, as Jenny said, that can affect any part of your bowel, from, your mouth to your back passage. Most commonly it affects the small bowel and the large bowel, and it can be quite debilitating. Fortunately, a lot of patients don't suffer so much, but yes, for some patients it can take over their lives.
It can be manageable, I think, can't it? But in an extreme, it can be so bad it can actually burn through the bowel wall, and patients develop abscesses.
That's right, yeah. Unlike colitis, where the inflammation is very superficial and sort of within these top layers of the bowel, in Crohn's disease it does have a tendency to go through the layers of the bowel and cause you complications.
So we talked about, the fact that this can be managed with steroids, for instance, as an example, for many, but it really does take over just about every sufferer's life. Is there any light at the end of the tunnel? Is there any research ongoing into this, that one day we may see a cure?
Well, there is a lot of research. At the moment, there are new drugs that have come up. More recently, there are what we call immunological drugs that we use for Crohn's, which have, made a big improvement. Nevertheless, because it's a disease that can come back, the aim really is to try and control it with drugs and medical management. And surgery for Crohn's disease is either for patients where medical management has failed, or for patients where they've had complications from medical management and they can't have any more medical management, or if they've had complications from the disease itself, like an abscess, or it's burned through their bowel and caused them to be very unwell.
Now, until the 90s, any surgery was quite invasive, wasn't it? Keyhole surgery, and we talked about that with Jenny briefly, has made it an awful lot easier, hasn't it?
keyholes, you see a lot of these patients are young patients, in their 20s, 30s, who to them body form is important, and no one likes to have a big incision down the front of their belly. And sorry about that.
Are you watching Mission Impossible? Or?
No, it's just a ringtone, I'm afraid.
Yeah, sorry. So you're saying, that there are cosmetic implications?
Laparoscopic surgery has started to, be increasingly performed within the NHS, and about 30% of patients today would have the benefit, if you look at figures across the UK, of having keyhole surgery done, which does make it quite appealing, and, has people turn around and think, shall I have surgery, shall I have more drugs? Some people would come around to the idea of surgery.
Well, I mean, it must have changed your life, Jenny, and you can wear a bikini still as well. But no, how much of an impact has it had on your life since the surgery?
It was fantastic. I had the surgery on day 1. Day 2, I was up walking around. Day 3, I was eating a normal meal. And I came out of hospital on day 5, and I was more or less back to normal. Taking it easy to a certain extent, but by this was in December I came out of hospital, and the 2 weeks after I actually went Christmas shopping with my daughter, and if I'd have had open surgery, there is no way I would have been able to have done that.
What was that experience of going shopping like? Because previously you'd have probably had to have thought, well, where are we going to go? I need to know where the nearest toilets are, and so on. Were you able to go without any concerns?
Without any concerns at all. I'd put weight back on, so I'd got more energy. We went shopping. It was great to be able to get back to some normality again. I'd almost forgotten what normal life was like. It was fantastic, and I was able to enjoy Christmas.
Sanjay, there's light at the end of the tunnel now. Do you think we're going to see many more of these operations?
Well, yeah, what Jenny had was something called single port surgery, where rather than have 2 or 3 little holes in your tummy, you have just one tiny hole at the belly button. And the idea being is that, this surgery we undertook at the Leicester Bowel Clinic at the Spire. And it is, I think patients, she found it amazingly good. She's very happy with the cosmetic result she's had. And certainly she was delighted. She came and saw me shortly after she'd been shopping. And it did feel good. You felt very satisfied to know that here's a patient who, you've helped in a big way.
You're doing a great job, Sanjay. Thanks for talking to us.
Cheers.
Thank you very much, Sanjay Chaudhri there. There is a sort of footnote to this, isn't there? Because there is some research that has proved that it can be hereditary, and it is something that can be within a family. That has to be a concern. But I guess for your children and grandchildren, knowing that now, you can look out for the signs early.
Yes. I mean, I would urge anybody, like with the signs that I had at the beginning, I just put them off because I thought, no, it's just stress. Then I thought it's in my mind when I lost my appetite. I'd urge anybody to go and see a doctor earlier rather than later, because if it's picked up earlier, the chances are that, the drugs might have worked quicker, but also I think if I'd have known about this type of surgery, I might have considered this earlier as well, instead of going through a lot more of medication.
Well, it's some sound advice. Thanks for sharing your story with us this morning. And I won't get you to show me your scar. And thanks ever so much for coming in, Jenny.
Thank you.
Thank you.
Leicestershire's weather.
BBC Radio Leicester. 25 past 10. Let's check what the weather's got in store.